All right, what's up? To kind of speed things up in this one, I drew these out. Um, well, this is the basic breast anatomy of the female reproductive system. And the point of these is very obvious. There's sexual arousal associated with these as well for both parties, so it aids in that. But then it's also for feeding young. And this is the basic anatomy. So we have the nipple with the areola around that. And then coming from this is a front view, and we have a side view here. So coming from the nipple, we then have these ducts, which attach to the mammary glands, which these are our milk-producing cells. Milk-producing cells to help feed our little babies, our little baby boys and girls. There's also adipose tissue in there, fat, to give them volume, but also to act as an energy source for producing the milk or for the mother over time. So the reason why the breasts swell after pregnancy is they're filling with milk for the baby, and that's stimulating. The stimulating of milk production is causing the enlargement of the breast. Okay. So how is that occurring? How is stimulation of milk actually occurring? Well, there's this drug released from our brain. You might remember this one. Oxytocin is released after childbirth. And I don't know if you remember this one, but this is, let's go back, oxytocin. Let's go back to the nervous system. Look at this, the whole class right in front of our eyes. Go down here to the brain anatomy. We got it right here, oxytocin. It's made in the hypothalamus, and then it's released from the pituitary. This is our love and bonding hormone. Chocolate simulates oxytocin. And this stimulates lactation. Right there, got it. Oxytocin stimulates lactation. So it's made in the hypothalamus, stored in the pituitary, and released from there. Okay, so bonding, just like seeing the infant and being with the infant, will cause lactation to occur. So once you start to lactate, as long as you are around babies and breastfeeding babies, you can continue to lactate essentially forever. So oxytocin is made in the hypothalamus. And released after childbirth. Stimulates lactation. It's released by the pituitary. Pituitary. And stimulates lactation. What is that? That's milk production. So yeah, women can continue to lactate if they continue to breastfeed. This is the idea of a wet nurse. This would be like what's called a wet nurse. Someone who breastfeeds babies. And breastfeeding is really good for your baby. You're giving your baby breastfeeding benefits. I don't know all of them, I'll be honest. But number one thing you're doing is you're giving them like your microbiome and antibodies, as well as no bullshit chemicals. You're also giving them like proper protein and sugars they can easily break down. Sugars and fats. It's all, it's what they're supposed to be drinking. Babies are supposed to be drinking breast milk. They're not supposed to be drinking formula. There's all kinds of benefits associated with this. I'm not going to claim to know all of them. But you're just going to be better off if you're a child who was breastfed versus one who is not. There's just no real way around that one. So it's good for, yeah, antibodies, this would be good for their immune system. Okay. All right, here's some fun facts now too. This is really fun. Men actually have mammary glands. I love this. I love this fact. Mammary. There's an A in there. Mammary glands. Thought to be vestigial, which means a leftover from evolution. It's a leftover from evolution. Like for a while, it was beneficial as primates for the men to also be able to breastfeed. But then at some point, we're like, now it's advantageous for just the women to have it, the females to have it, and for the men to be doing other things and to not be breastfeeding, because the men weren't breastfeeding anyway. So why have these highly developed mammary glands? They're not being used. Okay. Now, they're thought to be vestigial, but check this out. But in special cases, in special circumstances, men can actually lactate. I love this. This is why I love biology. And like developed male breast tissue, is called gynecomastia. Oops, not cyno, gynecomastia. Man boobs. Okay? I think one of my dreams, I'm gonna be honest, is to breastfeed a child. I think maybe I was a woman in my previous life. Makes sense. They're easing me in karmically to being a very masculine man. You know, I was born by lesbians this round. It's like I can handle that. But yeah, no, I mean, you know, I don't know, there's something cool about that, I'm sure. All my mamas out there that's done it. Seems pretty nifty. Okay. That's really all I want to talk about breast tissue. I mostly just wanted you guys to know this, that men actually have mammary glands, and in some special cases, like when men are around, they have the right tissue, the right hormones are being released in their brain because they're around infants all the time. They can actually breastfeed a child. That's pretty dope. Gotta say, ladies, you ain't doing it all. Some men be out there breastfeeding their children, brother. Now that's a man. It takes a man to breastfeed a child. Okay, well, let's talk about birth control. Contraception. Okay. And I think this is actually going to be the topic of the discussion today, because I find this to be an interesting topic. All right, so we're going to first talk about what are some options for men to use for birth control. All right. Condoms, obviously. And condoms, like the numbers on this is whatever. It's all kind of wonky, but these are about 86% accurate. Even with perfect use, you know, sometimes a condom's going to fail. Sometimes the woman is going to steal it and then impregnate herself with it. So it's like it's not. That does happen. Poke holes in it, all that stuff. About 86% effective. You can get a vasectomy. I'll talk about what that is. You get a vasectomy, which this is about 99.9% effective. What is this? What is a vasectomy? Well, what they do is they make a little incision here in the testes, right? And they're going to go into this ductus deferens, so they're going to make a little incision. And they're just going to snip that bad boy. And they literally tie it up with a little bow. And like any sperm and things that you have that are produced in here, they're just reabsorbed. by the tissue in there by the body. So that's a vasectomy. Okay. It's a very easy procedure to have. Boom, boom, not a big deal. You don't even have to be knocked out or anything like that. They numb you, make a little cut, do it. But it's not easily reversible. Can't always be reversed. So you're kind of taking a risk there. Okay, so it's not always reversible. Not always reversible. It's like, yeah, you can reversible. You could freeze your sperm and all that, but that's not also guaranteed to work. Okay, you have to have surgery. This is surgery. Surgery is required with potential permanent infertility. With potential permanent infertility. So you might never be able to have a baby again if you change your mind. Right? It's got some pretty strong side effects with that one. Okay. Obviously available to men is the most effective. Abstinence. Abstinence. Most effective form of birth control. I'm going to say 99.9% because somebody could sneak into your bedroom and steal your sperm. You know, even if you're abstaining, you know, crazy shit happens in this world. Somebody might sneak into your room middle of the night and steal your sperm. Somebody might cut your balls off and impregnate themselves with your balls, even if you've never had sex. Women be crazy, bro. Okay. The other is the withdrawal method. Withdrawal. More commonly referred to as the pull-out method. Pull-out method. This actually not that much less effective than condoms. About 78% effectiveness. It's pretty good. Pretty dang close to that. You know, it's obviously going to depend on the individual. All right, that's it. There is no other male birth control. There are 4 options for men to exercise their right to not be fathers. Right? Right? That should be a right, right? That's my right. Right? To not be a father. Okay. Cool. All right, how about for females? And there's like some topical creams and things like that are in the works, but none of those are released. And they're all focused on like reducing sperm count numbers so low that you couldn't impregnate somebody just based like there's just not enough sperm. But even then, it's like it still could happen. So we'll see how effective those are. All right, now for ladies. Let's do ladies. And we'll do ladies in this blue color. Okay. All right, well, there's the female condom. And I'm not going to give kind of numbers on effectiveness for this. Female condom. Interuterine device. It's an IUD. If you don't know what that is, we'll talk about it in lab, but you take a little device. Looks like this, and you insert it right there. Okay? Boom, boom. It's very, very effective. That one's like 99% effective. I will put the percentage for that one there. 99.9% effective. Very effective. Okay, then we have birth control pills. Those are just hormones you take to keep you away from ovulation. You keep your estrogen high, but you'll never go through ovulation, right? Because you need this dip in estrogen to ovulate. All right, you trick your body into basically thinking it's pregnant the whole time. But there's all kinds of side effects with that. A lot of women don't like to take that. That's your choice. For some women, it does work. Okay. Abstinence is also available. abstinence. It's also available, right? Not having sex. Skin patch, which is also hormonal, release of hormone. The implant, which you implant under the skin, also hormonal. Nuva ring, which is a ring that you insert right into the vagina. That releases hormones right there locally to prevent ovulation when not wanted. A diaphragm, which is like a little cap. It's like a little like plastic cap that you would take right here. Let me move this hot sausage down here. This hot little stick of meat that I drew. Let me move him. Diaphragm kind of, it's like a little cap that you sit right in there to prevent sperm from getting up in there. It's not super effective, but it's also available, and if used properly and the sex isn't too animalistic, it won't be dislodged. Okay. Tubal ligation. It's another one. So that's basically cutting these fallopian tubes, similar to the ductus deferens, the vasectomy, preventing the ovary from ever coming down this way or sperm ever getting to it. Okay, it's a tubal ligation. Get your tubes tied. Okay, tubal ligation. All right, what else is available? Depot shot. So this is a shot you can get. I think it's like once a month. I don't actually know much about that one, but it's hormonal. Spermicide. So you can take a chemical that will kill sperm, prevent them from swimming, destroy them. It's like a foam. You put it in the vagina, squirt that in there. And there's more too. It's not a complete list, obviously. But then there are things like the morning after pill, which will delay ovulation. And then there's also like abortion pills. Abortion pills. And like a vacuum-based abortion. Where you go into a facility and they go up into the uterus and remove the embryo via that suction. They basically suck it out with a vacuum. Sorry if anybody's triggered by that. I don't mean to bring up any pains. Okay, but these are the options. These are the options available to females for birth control. Whether or not they become a parent. And I don't know if you noticed, but they just have a lot more. Why is that? Well, when you're working with a female, you're really regulating the release of a single egg, a single oocyte. That's much easier to control than the release of 2 to 600 million sperm with every ejaculation, right? Man can essentially ejaculate, and probably wouldn't be that many each time, but like an unlimited number of times a day. I mean, eventually you'd get tired or whatever, right? That's a lot. That's a lot to regulate. Like this thing is just making sperm after sperm after sperm after sperm after sperm. So it's tough to regulate that. But that leads to kind of an imbalance, right? In our ability to have birth control. I mean, as a man, I don't really have any option other than these available to me to regulate whether or not I become a parent. And women have more. So I think I'm going to have that be the topic of our discussion. They have way more forms of birth control. I think it's pretty interesting. I'm curious on your guys' opinions on this. So they have more ability to regulate whether or not they become a parent. Okay. Now, up here we've got abstinence, which is the most effective form of birth control. And men and women both have access to that, right? But, let's be honest, with most people, we're not going to succeed at using this one forever. Sex feels good. Orgasms feel good, right? So we're going to want to do those from time to time. I mean, it's one of hierarchy of needs, Maslow's hierarchy of needs. Maslow's a pretty smart guy. Sexual fulfillment is part of our basic human needs. Like, we don't fully need it to live or survive, but so we're never going to fully succeed at that. Most people aren't. All right, so then it's really, men have 3 options. Condoms, vasectomy, withdrawal. Condoms, those things suck. Most people don't like those, right? Let's get real. Men and women, not necessarily the biggest fans of condoms. So then we got vasectomy and withdrawal method. So really, you're kind of down to 2. You're down to condoms, vasectomy, withdrawal method. I'll say 3. If you're going to have sex. All right, well, but I don't know. Abstinence is a fantastic form of birth control. So let's maybe work on that one a little bit. Let's do another little form of birth control. And let's talk about STDs or STIs. STIs or STDs, sexually transmitted infections or diseases. All right, these are a great form of birth control, is learning about these. Okay, so the first one we're gonna talk about some that are curable, and this is not going to be a full list. Chlamydia. This is a bacteria, and these are some of the symptoms over here. This would be cause, and this is symptoms. This would be the name. Okay. Symptoms in males, it would cause penis discharge. In women, it is often asymptomatic, but it will also cause vaginal discharge. And a lot of these curable STIs are transmittable even when you're not symptomatic. So don't trust people if they say they're clean. Like, if somebody's sexually promiscuous, having sex with a lot of different partners, with protected or unprotected sex, like, before you have sex with them, have them get tested. Like, just go into your doctor or to the local clinic. I don't know what our health facilities are like here in Merced for this, but like, it doesn't take that much effort to go get tested for STIs. Like, I would go do that all the time, and people would be kind of like, the nurses would be flabbergasted. They're like, "Wait, you don't have any symptoms?" Like, "No, I'm just like gonna have a new sexual partner. I want to get tested and make sure I'm good for them, and making sure that they're doing the same thing, that they're good for me." And they're like, "Man, I wish most people did what you did." So like, it's pretty smart to do that, because there's some of these you don't want because you can't ever really get rid of them. Okay, so chlamydia, we can treat this one. It's treatable. Right, you can take antibiotics and get rid of it because it's just a bacteria. All right, now we got the next one, also treatable. Street name. We'll do street name. This boy, the clat. I don't really remember why it's called the clat, but the clat. Okay, this one is gonorrhea. Don't want this. It's also bacteria. And, oh boy. Pus from the penis. We don't want that. I don't want that. Okay, and vaginal discharge. Vaginal discharge is also often asymptomatic in women. Again, right? This one's a sneaky one. It's also treatable, but here's some little facts. 20% of men won't show symptoms. 80% of women won't show symptoms. That's a lot, dude. So you really can't trust somebody if they're having a lot of sex, protected or unprotected, because, condoms aren't, sometimes they slip off, and especially if people are using drugs and alcohol when having sex. All kinds of crazy stuff can happen. For example, I will tell you a story of somebody from my life who told me this, that after a bunch of drunk sex, the doctor found not one, but two, this is really gross, tampons shoved up here in the fornix. Not one, but two. This is a recipe for getting toxic shock syndrome, for getting vaginal infections, for getting an infection in your uterus. Okay? So let's be a little smart about our intercourse. Okay. This is also treatable. Treatable. CLAP. Chlamydia and gonorrhea. Boom, 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 boom. Both of these. Bacterial infections. All right. Now we're going to go into a eukaryote, bacteria prokaryotes. We'll make this one green. This one, street name called trick. This one's caused by a protist, or actually it's called trichomonas. And it's caused by, that's the actual scientific name of it. Trichomonas, there we go. That's caused by a protist, which is a evolutionary catch-all for little microscopic organisms. And I'll draw this guy for you because he's kind of cute, actually. I like the way they look. Kind of look like this, and they got a little flagella. They got like little flagella up here, and then they've got a little wavy ruffle on the side. And these do really well in the vagina because they have a lot of room to move around it. They swim with their flagella. And they do really well in the vagina, but in the penis they can also thrive. Penis discharge cause inflammation. But they do really well in the larger, more nutritious vagina. That is a large, nutritious vagina. Okay, and now are you ready for this? I'm not. This leads to a frothy, foul-smelling vaginal discharge. Okay. This one's also treatable. Luckily, it's also treatable. All right, let's talk about one that's not treatable. HIV. Okay. HIV is the virus. This is human immunovirus. Human immunovirus. And over time, this results in AIDS, which stands for autoimmunodeficiency syndrome. Autoimmunodeficiency syndrome. Autoimmunodeficiency syndrome. Okay. This infects your white blood cells. And so that's why it leads to an autoimmune deficiency syndrome, is like your other immune cells are attacking your own immune system. And so this depletes your T cell population, and death is caused by a secondary infection. Okay? If you get AIDS now, if you get HIV or AIDS now, your chances are pretty good to have a semi-normal life. You certainly don't want this, but it's not as of a death sentence as it was, back in the 80s or 90s. Okay? So this is a lifelong disease. Lifelong disease. There's no cure known. Some symptoms are fever. It's like flu-like symptoms: chills, night sweats. It's like you are really sick with the flu. You really got to take care of yourself if you have this. Yeah, and some of the things that will kill you are like tuberculosis, which is usually not going to kill you if you're just infected with that, pneumonia, or even a cancer, right? Because you're killing your immune system, which would normally be killing and keeping your cancer in check. All right. Definitely don't want that one. And we'll just do two more. So we've talked about bacteria, a protist, which is a eukaryote, and then a virus, which is technically, according to biologists, not even alive. Now let's talk about an arthropod. Street name for this is crabs. This is pubic lice. Pubic lice. These are insects, or arthropods. It's a bug, man. This is a tiny little bug living in the jungle of your pubes. I'm gonna make a funk album, and I'm gonna call it that. A tiny little bug living in the jungle of your pubes. It's pretty good. It causes itching, pain. Oops. Itching, pain, and can be transmitted without sex, right? Just a little, I don't know, I just transfer my hand and touch you, or maybe just a little dry humping can transmit these. So keep it clean. This one is treatable, luckily. You're not stuck with the bugs forever. Shave all that crap off, take some antiparasitics, use an ointment, and you're good. Okay, and let's say last but not least, we got a yeast infection. So now this is a fungus, a yeast infection. We got a fungus. Okay. And this is not always sexually transmitted. Not always sexually transmitted. Women are more susceptible to these. Like if you take an antibiotic or something like that, that can throw off your microbiome in your vagina, and then like the fungus in there will take over. Not always sexually transmitted. Onset can occur from, let's say, taking antibiotics that kill bacteria, that kill off the microbiome in the vagina. But they can be sexually transmitted from women to men. But men can acquire them sexually from women. And this will cause, in men it causes penis discharge, our favorite. And in women it causes vaginal pain, inflammation, and last but not least, cheesy discharge. Okay. All right, so hopefully that kind of helps you with abstinence, right? And being safe when it comes to sex. And, it's kind of interesting that we cover like The only thing that there isn't a sexually transmitted disease of is a plant. We got bacteria, we got viruses, we got protists, we got fungus, we got insects. I guess there's no mollusk. But you see what I'm saying? Like, it's like plants got our backs, bro. All right. Most of these are treatable, but like HIV, oh, this is also treatable. Herpes isn't. I'm not going to go into herpes, but it's a virus too. Treatable. All right. So these are some good reasons for abstinence, these sexually transmitted diseases. And I just wanted to show this last little video here about childbirth, because I don't really have time to go into the development of the embryo in super details, but childbirth is pretty freaking amazing, and this is a good little animation. So we'll just kind of watch this too.
And starts when your baby settles lower.
So that's our little cervix there.
In response, your cervix begins to efface or become thinner and dilate or widen. During this time, you may feel strong, regular contractions occurring every 5 to 20 minutes, and lower back pain and cramping that doesn't go away. You may see a brownish or reddish mucus discharge, which could be the mucus plug at the opening of your cervix falling out. Your water may break, which can either be a large gush of fluid or a continuous trickle. If you experience any of these symptoms, contact your doctor or midwife to see if you should go to the hospital. At the beginning of stage 2 of labor, which can last from a few minutes to 3 hours, your cervix is fully dilated to 10 centimeters, and your baby's head has moved beyond the cervical opening into your birth canal. During this stage, you will begin to push your baby out. You may instinctively push when you feel the urge, or you may need coaching from your doctor, midwife, or labor nurse as to when to push and when to rest. In a normal delivery, your baby's head will rotate to face your back. During active labor, your uterus is divided into an active segment that contracts, pushing the baby downward, and a flexible passive segment that remains relaxed, stretching to provide more room for the baby to pass through. In some cases, when the top of your baby's head appears or crowns, your doctor may make a small cut called an episiotomy to enlarge the vaginal opening. Then you will continue pushing your baby out. As your baby's head passes through the birth canal, it molds into an elongated shape.
Are like describing the little fontanelles, the little spaces between the skull bones, and like how the baby's skull elongates into like a cone head during birth.
An elongated head shape will resolve itself within a few days as the skull bones shift back into place. After your baby's head exits the birth canal,
it just looks so good.
His or her head and shoulders will rotate to help the shoulders pass through the birth canal.
It's easy peasy from this point on.
Your baby's shoulders are delivered one after the other in order to fit through your pelvis. Once the shoulders emerge, the rest of your baby slides out easily.
Baby feet. That's some big baby toes.
After your baby is born, his or her umbilical cord will be cut. In stage 3 of labor, which may last 5 to 30 minutes, mild contractions will help push the placenta out of the uterus. During this
Oxytocin.
stage, you and your baby may begin bonding through skin-to-skin contact and
get that bonding
breastfeeding.
going on with your baby. All right, guys, that's the reproductive system. There's a lot more I would like to talk about, but, we'll get to go over a little discussion on this, the birth control options, and kind of what that means, and kind of your thoughts on that. I'm curious about that. So I hope that was informative. I hope you understand what ovulation is. I actually forgot one other method here that's pretty commonly used. Rhythm method. So this is understanding your ovulation time, and you just don't have sex during the windows in which you could be pregnant. So right around ovulation. You just avoid sex, or you have other birth control methods around then. And you can keep track of your rhythm method by keeping track of the days and also taking your temperature every day to see when you're ovulating, because there's a little change in temperature during ovulation. Yeah, fun topic. I'll see you guys in lab later.